darkest fears are gonna come for you, come for you.
Hello everybody, welcome to today's episode. Today we're going to be discussing anaphylactic shock. We're going to be talking about what anaphylaxis is and why it happens. We're going to be talking about how we can recognise a patient in anaphylaxis and what you can do to help save a life of this person having an anaphylactic reaction. So let's start by very quickly covering what anaphylaxis actually is. So, an anaphylactic reaction is a body's exaggerated response to an allergen. So for argument's sake, let's say that somebody was allergic to peanuts, okay? They've accidentally eaten a bar of chocolate with a peanut inside. Now, instead of getting a little bit scratchy and itchy until that wears off, instead the body has a complete overreaction to that trigger. Now, anaphylaxis is actually an autoimmune response. So when we come into contact with that peanut, the body will go into overdrive. It will release an unusually high amount of chemicals, the main one being histamine. And too much histamine in our system is actually incredibly dangerous. What histamine and the other chemicals that are released due to the body is completely cause vasodilation everywhere. So the body goes into circulatory failure. In layman's terms, that basically means all your vessels that carry your blood start to open up and your blood pressure plummets. This happens in a very, very, very quick window, which is why anaphylaxis is so dangerous. Now, whilst all this fluid is seeping out to places it shouldn't do, on the outside, this will present in a rash, in hives, urticaria, swelling, so the lips will become swollen, the tongue might become swollen, but what you have to take into consideration is if they look this swollen on the outside, imagine what the inside of the airway is going to look like. So we've got complete total circulatory failure, and we also have a problem with the airway developing as well. So anaphylaxis is incredibly dangerous. So how are we going to recognise it? Well, first things first, that patient might tell you they are having an allergic reaction, they've accidentally eaten or come into contact with something that they shouldn't be touching or that they can't eat. Okay, now people who are known to have anaphylaxis should be carrying an auto-injector with them of some kind. Now these ones are called EpiPens, and EpiPen is just a brand name for an auto-injector. Inside them they carry a dose of adrenaline, also known as epinephrine, hence the name EpiPen. Now, this patient will start to look a bit pale. They might start to feel a bit dizzy as their blood pressure starts to plummet, and their breathing is going to get faster and faster and faster. Their heart rate is also going to get incredibly fast. So if you're able to feel for a pulse, we're going to expect that to feel quite rapid. Now, the more into the anaphylactic reaction they get, the more time critical they're going to be. And this happens very, very quickly over the course of sort of 5 to 10 minutes. Okay, so we need to be able to recognize it quite fast. All right. When it gets to the more extreme end of anaphylaxis and the airway continues to swell, they're going to start wheezing, and we'll be able to hear that wheeze in some cases. And we quite often hear something called stridor. Now, stridor is a really high-pitched sort of squeak that comes from the upper airway as it begins to close. It's quite a scary noise to hear. And that's a really worrying sign, because that means that that swelling has become so severe, we now run the risk of that airway shutting altogether, causing an inability to breathe. Okay, so whilst all that is going on, we need to figure out a way to help them if we can. So first things first, let's move them away from that allergen. So if that chocolate bar with the peanut is still sat on the side next to them, get it away. Okay, second thing is we have got to call for an ambulance. Anaphylaxis will kill that person very, very quickly, so we must let the ambulance service know exactly what's going on and exactly where we are, so they can get to us as quickly as possible. Anaphylaxis is a very high priority call for us because it makes the person poorly so quickly, and they can go into cardiac arrest within minutes if we don't get them the treatment they need. So give us a call, get us running. We then need to establish whether or not they have their auto-injector on them. Now, most people that suffer with anaphylaxis should carry 2 auto-injectors or EpiPens on them at all times. Whether or not that is the case is another question. However, hopefully they have at least one. Now, unless you are properly trained to deal with an auto-injector through first aid at work or something like that, then we don't recommend that you actually give this yourself. But what you can do is assist that patient to take it, okay? Now, we have 2 main brands. We have EpiPen, which is this one, and we have something called the Jex. They're both very similar. They work exactly the same ways. okay? But the EpiPen is the main one that's distributed out. And we have a bit of a saying for these. It's blue to sky, orange to thigh, okay? Now, before we consider giving this, we need to make sure that it is in date, okay? Now, adrenaline is quite a special drug. It's one of the few out there that we can take after it's expired, okay? But we have to make sure that it is still safe to give. Now, this is a training pen, but on a real EpiPen, we have a little window, okay? The Jex has one as well, and we can actually see the adrenaline inside the pen. Now, what we're looking to make sure is that the adrenaline is clear fluid and there's nothing floating in it. If that is absolutely fine, it's clear, there's nothing floating, then that is safe to give. So, we remove the blue cap, okay, and that makes it live and ready to go. So we'll hand it to the patient, and we want them to insert this into the fattest part of their thigh, just here, okay? And you don't have to push down hard, you'll hear a click when it goes in, okay? You don't have to do this, you can literally just pop it straight in like this, and you'll hear that click. Now we're gonna hold that there for 10 seconds to make sure that the adrenaline is fully distributed out of the pen. Now what you've got to remember is that once we've given this entire area is going to have vessels that constrict, okay? So if we do have to give a second one, please ensure that you give it in the opposite thigh, okay? Once that is done, don't throw this away, okay? Because the ambulance service would like to have this to make sure they know exactly what dose has been given, okay? Once you've administered the EpiPen, we need to lay the patient down and raise their legs. This is really, really important. Okay, anaphylaxis is one of the only few breathing difficulty scenarios where we would recommend you lay the patient down, and that's because the blood pressure plummets so quickly and we need to raise it as fast as we can. Laying them down and raising their legs to the point where their feet is above their heart is the quickest and easiest way to do that without specialist medical equipment. So we always recommend doing that, okay? And we need to coach their breathing. Lots of reassurance, let them know the ambulance service is on their way. Now, adrenaline is great, but it only buys us a little bit of time in a lot of cases. So you might find that after 5-10 minutes, that patient might start to feel short of breath, dizzy, generally unwell again. If that is the case, you can then assist them in taking their own second EpiPen or auto-injector in the opposite thigh. Okay, if they have to have a second one, let everybody on the other end of the phone know that they've had a second adrenaline, and they will try and speed up that ambulance if it's not already sped up and on its way for you. If you've enjoyed this video, hit like. I will place the website for my training facility in the comments and at the end of this video. So if you want to come along and do some of our face-to-face training at ALR Training and Events, we're based in Buckinghamshire, we'd love to have you. If there's any videos in particular that you'd like us to arrange for you, again, drop me a comment, send me a message, and we'll see if we can get those scenarios covered, and we'll be looking at uploading some more videos for you soon. Hello, my name's Suzanne. Are you okay? Are you struggling to breathe? Can I help you? Can you tell me what's happened?
Sting.
A sting, a bee sting? Are you allergic? Do you suffer with anaphylaxis?
Yes.
Okay,
Yes.
alright. Slow your breathing down. Take some slow deep breaths for me. Well done. Have you got an EpiPen or an auto-injector? Can you do it yourself? No? Okay. Right, give me your hand. I'm going to pop it in your hand. Okay, that's ready to go. If you can do it yourself for me. Ready? 1, 2, 3. Okay, well done. Lovely, let me take this away for you. How are you feeling now? A little bit better? Okay, fabulous. Is this your second one? Let's pop that out the way for a moment. Can we raise your legs and lay you down? Lovely. Can you shuffle over and we can pop your feet up here? Wonderful. A little bit more for me. Very good. There we go. Lay down and relax. Okay, well done. How do you feel?
Better, thank you.
Good, good. So, let me know if the breathing starts to get worse again. An ambulance is on its way. We'll make sure one is called for you. Okay, take some slow deep breaths.